Hello, today I wanted to talk about preparing to bring your newborn baby home. First of all, there's just a few really necessities that you need to bring a newborn baby home. Just focusing on diapering, feeding, clothing, safe sleep, and having a car seat are just the major things that you're going to need. So don't stress about all of the other little things that you may not have yet because you won't really need those in the first few weeks. So when we talk about diapers, we want to talk about how many wet and dirty diapers to expect. So the first 24 hours, you're probably only going to see one or maybe two wet diapers and maybe a stool. But as we get past days like 2 and 3, we should start to see about 5 to 6 wet diapers a day, and then 3 or 4 stools a day. If breastfeeding, if formula feeding, you may see a little bit less than that. And also kind of knowing that those first stools are going to be the meconium, which is very black and sticky and like a tar-like substance. Also, you want to remember to wash your hands really well after changing diapers. As far as feeding goes, we encourage you to feed on cue, which means when your baby is showing you cues that it's hungry, such as rooting around, putting its hands to its mouth, smacking its lips, fussing, things like that. So feeding your baby on cue helps them to kind of just establish their own routine. And in the first week or so, the first few days, their tummy is only about the size of a marble. So it can only hold about 15 milliliters of breast milk or formula. Breast milk is going to go through a baby's digestive system more quickly than formula. So don't be surprised if a breastfed baby wants to feed a little bit more often than a formula fed baby. That feeding amount will increase as the child gets older, but you still are only going to be giving about a couple of ounces every 2 to 3 hours. If it's a formula fed baby and that formula is staying in their gut a little bit longer, they may go for like a 4 hour period. Babies should nurse about 8 to 12 times in a 24-hour period. If they get all of those nursings in and then they want to sleep for a stretch of, 5 or 6 hours through the night, it is fine and you do not have to wake them up. Safe sleep. We want the baby to sleep on a firm mattress. We do not want the baby to get too hot. No smoking around the baby. And if you place the baby on its back to sleep, these are all things that will help reduce the risk of SIDS. Bed sharing is something that you kind of have to make your own decision about. Some research says that it's not safe, some says that it is. It's really kind of a personal decision. There are some ways to safely co sleep, there are some co sleeping beds that you can buy that go in the bed with you. But we also encourage, like the bassinets that have the drop side or the crib that you can place right up next to your bed, what's level with your mattress. So the baby is technically right with you, but they are in their own bed, which is safe sleep. Um, just something that lots of parents notice when they bring their newborn baby home and can be concerning sometimes is their breathing patterns. Babies have something called apneic breathing, and so it's very common for them to, breathe at a normal rate. About 40 to 60 times breaths per minute is normal for a newborn, but then sometimes you may see them breathe really fast for a few seconds and then stop and hold their breath or not breathe for about 10 seconds and then kind of start again. That is normal. The only time that we would encourage you to seek immediate care for your baby is if you are noticing your baby using all of their accessory muscles to breathe, which means that they are really struggling. If you are seeing their chest cave in and you are seeing their ribs every time they breathe in, and they are making any kind of grunting noises, that's an indicator that the baby could possibly have an infection and they need immediate care.